Straight Cub Song, the Cub Song contest on 720 WGN. Details are at WGNradio.com.
In our health segment this morning, doing something to slow the rise of, well, seemingly the ever-rising cost of health care in this country. One thing is to reduce the number of times that somebody has to be readmitted to the hospital. It's the readmission rate, obviously. How much could this save? Well, maybe around $17 billion a year in just Medicare costs that could be avoided, according to the Center for Medicare and Medicaid Services. Hospitals are going to have to do something about this because later this year, those hospitals that have high readmission rates will have their Medicare payments reduced. You need to know about this. One simple money-saving and kind of a patient-friendly way is to not go to the hospital in the first place. The obvious alternative for more and more people is in-home health care. Joseph Haughney is the president of CovenantCare in-home, or at-home, and that has facilities all over the country. It's based here in Chicago. Joe, I've done some research about this. Hi, by the way.
Hi, Bill.
It makes sense to me on so many fronts. Why isn't the healthcare industry automatically directing patients to home health care? Is it that they make hospitals that is more money keeping them in the building?
Well, I think in many ways people don't understand some of the benefits of home health care for the people that they work with. I think that's one of the doctors don't always understand, and it's it's very economical, and people just get better faster in their own homes.
Yeah, the knee-jerk reflexive response, I assume, is, you got an ailment, you go to the hospital. So for who? It's not for everybody.
No.
So for whom is it most appropriate?
Home health care is really appropriate, especially for seniors who are recovering from illnesses, surgery, or stroke, because what we do, we bring in a team of healthcare professionals, that physical therapists who can come in and really help you get out of your bed, give you the right type of exercises, a nurse that can come in and take care of your medications, manage a wound, or even a nurse's aide who can come in and give you a shower in your home. So when you're recovering, it's that period of about 6 weeks after you get home that we can help you, and a lot of times, make preventable type of things, so you don't have to go back into the hospital.
Are there conditions that you can just tick off that would be likely to be suitably set at home?
Yeah, one of the things that we do, one of the big things for seniors is heart disease. So people once they're admitted to the hospital and they come home, they have heart disease. So one of the things that home health care can do is provide a series of visits, and then we provide phone calls. So we'll give a call every day to that person just to check and see any pain, how you doing that day. We show them how to use a blood pressure cuff, so they check their blood pressure. So the thing that can happen then, if someone has a problem, we can send a nurse right out, intervene, talk to their doctor, and hopefully prevent something before it gets serious and go back to the hospital.
Joe, what can families do if they feel, say, that grandma is a good candidate for in-home health care, but the doctor is saying, no, best thing is to send her to the hospital?
Well, I think that, again, you have to work with your doctor. So obviously, home health care, we rely on doctor's orders. So you really need to know a little bit about the condition that your grandma might have, and then work with the physician to say, we like someone at home because it's a better quality of life.
Does the insurance industry make noise about this? Because oftentimes they're the ones paying for that.
Yeah, well, certainly Medicare does, because one of the things about Medicare is it doesn't cost the patient anything for home care. There's no co-insurance, there's no deductible, so it is really economic for someone with a Medicare to just come home and recover.
I think because of the Health Care Reform Act, it's going to be in the hospital's best financial interest to get on the bandwagon here. And I assume that, was it October that the law starts passing hospitals?
The new Affordable Care Act has a penalty for hospitals that have readmission within 30 days. And one of the things that we did as an organization in our Denver office, we participated with hospitals and other providers to take a look at readmission rates. And through this program of communication, we were able to reduce the readmissions of that control group by 10%. So that saved millions of dollars. If you extrapolated that out, it would make a lot of sense. Those are the preventable things like medication management, communicating with the doctor, type of things to prevent falls.
The overall quality of life to have somebody at home and still get the care that they need and not have not just the expense of being in a hospital, whether or not it's covered by Medicare, but the inconvenience and just sort of the atmosphere of a hospital certainly is a lot worse than being at home.
There's no question. People really, studies have shown that they recover faster at home when they're in their own environment, they have their own meals, There's no question that people just feel better, and the quality of life is better. So if you can get a little bit of help from those nurses, physical therapists, that can make all the difference in the world so that you recover in a timely way without getting back to the hospital.
And obviously people are fully assessed, because I can understand somebody saying, I'm just worried. I want them to be in the hospital because if something happens, they'll have all that equipment right there at the ready. But it's not you're not putting people that have a high risk level.
No, absolutely not, because you really want to work with your physician. Again, the physician has to sign the order for a plan of care at home, and so they understand if the situation is critical or not critical. And normally, the home health care is done after you've had, like I say, surgery or an illness, so it's that post-acute period of time that you're recovering from. So.
Well, I have to believe, maybe simply because the Health Care Act is going to make the pressure on the hospitals change, I have to believe this is going to be very big, that with the aging population we have and the pressure to lower health care costs, and the fact being that they're going to get better care, better quality of life, or not, I guess, can you say better care? Adequate care. What they need, they'll get, and they'll be happier, and it'll cost less. We'll just increase this in-home business by leaps and bounds.
Yeah, there's no. That's what we feel. For example, just to improve the management of medications, just think of the people who come home, they have all the pill bottles. They get a little confused in terms of how to take their medicines. Do they take it at 9 or 10 or 11? And so home health care can help you establish a system to take your pills, educate you about those pills. That's one of the real benefits that keep people just feeling better and healthier. It's just a big benefit for folks.
Joseph Haughney is the president of CovenantCare at Home. What's your website, Joe?
Our website is CovenantCareAtHome.org. So that's the way to get information, CovenantCareAtHome.org.
Simple and direct.
Yes.
Joe Haughney, thanks so much.
You're welcome, Bill. Thanks all.